My name is Lauren Schwartz-Roth, and I am a psychologist. And I've worked for many years in the field of what we call behavioral medicine or rehabilitation medicine, which is working with adults who have acquired disability, physical and cognitive disabilities. I was at the University of Washington Medical Center for about 30 years working on those patients and doing research with them. And then about 25 years ago, I had a child and she was diagnosed with Prader Willi syndrome. And I got involved with the Foundation for Prader Willi Research a few years after that. And pretty much since that time, I've also been working with the Foundation for Prader Willi Research, overseeing their behavioral and mental health research programs and as part of their scientific advisory board. And I also have a practice as a clinical psychologist and have another daughter who does not have Prader Willi syndrome. As I mentioned, I have two children, and one has Prader Willi, the other one does not. And as my other daughter's getting older, and she's graduated from college recently, we've had many conversations over the years just about her experiences growing up with a sibling with Prader Willi and kind of her understanding of her sister's challenges and the ways that it's affected her. So I've always been interested in that, probably being a psychologist and a mom. But also over the years, many family got come up and talk to me at conferences and have asked me how my other kids doing. A lot of focus is on my child with Prader Willi or in here at the conference learning things, but I do wonder how all this is affecting them. And so it seemed like the time to do a study and try to understand more about the impact of growing up with some of Prader Willi on the other children in the home. Now, there have been a few studies in that area. A lot of them were having focused on talking parents, some talking to the actual siblings themselves, but I thought it was really important to actually try to do some sort of in-depth interviews focused on their experiences. First, we created an interview that was sort of semi-structured with a variety of open-ended questions. And then we recruited participants from social media and emails. And we basically asked for siblings who might be interested in participating in an interview study that was done on Zoom about their experiences growing up with a sibling with Prader Willi syndrome. And we asked that people ages 12 and above reach out to us if they were interested in. And of course, we got IRB approval and got consent from everybody and was able to get consent from parents of people who are under the age of 18. And then I scheduled interviews over Zoom with 25 siblings, ages 12 and above. If you look at the general literature examining the impact of growing up with a person with a disability on siblings, so any kind of disability, in general, you do see higher distress rates and some other challenges. And disabilities that have more behavioral challenges as part of a disability also tend to have more impacts on siblings. So one of the things I asked about was, what are the ways that growing up with sibling Prader Willi syndrome has affected them emotionally? And I just left it open-ended to see what they would come up with. And what we heard was over about 55% of siblings reported having a lot of stress, frequently feeling very stressed. About 50% reported having a lot of anxiety, which they felt was related to, certainly in part, growing up with their sibling with Prader Willi syndrome. Siblings also reported having some feelings of embarrassment and frustration, particularly related to events that were often would be considered enjoyable, like going on vacation or going out to dinner. Those were often times that were difficult for siblings. So with a condition such as Prader-Willi syndrome that has a lot of food impacts, it would make sense that the whole family would have some to us changes and impacts to them, food and eating behaviors. And so that was one of the questions that I asked siblings. And one of the we had several themes that came up. And one of them was being highly food focused themselves. Actually, 64% of the sample reported that they were much more focused on food than my friends were. They thought about food a lot when they went to places. They kind of, figured out where the food was, um, and they found that this was, challenging and definitely felt that it was related to growing up in their home with someone with Prader Willi syndrome. We also, siblings also talked about eating in secrecy. One sibling said that sometimes she would go inside the pantry, which had a door, and close the door and eat there. Others described when they go over to a friend's house that they would sort of raid their pantry, or some of their friends would have special snacks for them because they knew they couldn't have them at their house. That was sweet. So there was a lot of impacts on the relationship with food. We also saw that 12% of the group that I interviewed reported having a diagnosis and treatment for a form of eating disorder, which is actually higher than the general population, which is about 8%. Now, in our study, we didn't specifically ask about all of the criteria for eating disorder. We just asked in general, and so people sort of told us that. It may be that if we had asked those specific questions, we may have seen even higher rates, and I think that will be a good area for our future research. One thing that some siblings mentioned and others suggested it would be a good idea was to um, check in with them about how they were doing, specifically related to their sibling with Prader-Willi syndrome. And some of them described almost a process of debriefing, especially after a challenging PWS moment, either an outburst or a food-sinking episode, that these siblings really appreciated the parent taking the time to sit down with them, kind of talk with them about what happened. Some of the other things siblings found was helpful was sort of the parent giving them some guidance around how to behave or what they could do or not do during the tantrum or during the feed-sneaking episode. Um, some siblings really wanted permission to be able to leave, and even encouragement to do so. Other siblings really wanted to help out. And I think that's just sort of different personality styles. And they desired some kind of strategies on how they could help, what would be the most helpful in those situations. And some siblings also felt responsible when their loved one with Prader-Willi got into C. And so I think talking with them about that in time it wasn't their fault was also really helpful. One of my questions I asked was, how do you cope when there's something stressful going on with their sibling with Prader Willi. And many siblings described one form or another of taking space. So either going to their room or sometimes leaving the house or taking a walk. They were old enough to drive. They might get in their car and go somewhere, go over to a friend's house. And that was really helpful. And they appreciated parents kind of giving them permission to do that. At one point in the interview, I gave siblings a list of different sort of coping resources and strategies that are listed in the sibling literature as potentially helpful, and asked them to uh, talk about or to rank which they felt either would be helpful or would have been helpful. So looking back, um, and the top two things that were mentioned was connecting with other Prader Willi siblings. And it seemed really important that it be other Prader Willi siblings. They really felt that it was such a unique condition, and the way it affected their family was so unique that they really wanted to be with other people who got it. Um, the other thing siblings talked about was wanting to have time alone with the parents. They, many talked about how they felt that their parents, so much of the parents' time that kind of emotional resources was taken up by the person with Prader Willi, that they didn't feel like they had a lot with ever for themselves sometimes. Sometimes they even felt overlooked or pushed aside. And so they really crave having special time with the parent where it was just them without the person with Prader Willi. We did look at birth order, and we did find some differences. And a little over half of the siblings that I interviewed were older than the person with Prader Willi. So we were able to look at some of those differences. The older siblings often felt more responsible and sometimes felt more guilty because they were older and they thought that they should be more helpful or that they should be responsible for this sibling, not getting into food. And so they kind of wore a sense of responsibility, which I think was hard for them. The younger siblings often talked about feeling like the older sibling, even though they were younger chronologically, often because they, in a sense, had to take on more responsibility. And also just developmentally, at some point, they surpassed their sibling with Prader Willi. And so sometimes they took on the role of an older sibling. I asked siblings a couple questions about whether there are any positive aspects. One thing I asked was if they could tell me what were some of the positive things about their sibling with Prader Willi and what were some of the things that they were good at. And I was really heartened to hear that they had a lot to say. They described their siblings of Prader Willi as smart and hardworking, friendly, loving, caring, brave. So there was a lot of positives that they felt about their sibling, in addition to the difficult times. In terms of positive qualities that the siblings feel that they gained growing up in this family, many of them felt that they had gained a greater sense of compassion and empathy, especially for people who had differences, a sense of responsibility. One of the siblings said, "I'm way less judgmental than all of my friends." And that was a teenager, and I thought that was a great quality to have. Um, and a sense of independence, as I mentioned earlier, kind of taking on responsibility at an earlier age. And for many of them, that helped them feel that they could kind of accomplish and take on things more than their peers could. one of the siblings said, "We matter too," which was kind of heartbreaking, but also sweet to hear. And I think it's important as parents, and I'm a parent too. I have two kids. And so I do think it is important that as much time as we devote to our children with Prader Willi, to really give that time and attention to our other children as well. Encourage them to kind of find their own thing. A lot of the siblings talked about getting involved in a sport or a creative outlet like dance or drawing, and really encouraging them to have something that wasn't Prader Willi, that wasn't about their sibling. And if possible, supporting that, attending events. Um, One woman talked about being involved in softball, and her dad came to every game, and that really stood out to her. Can't think of other things. Having time, setting aside time to debrief when there's a stressful moment with the person with Prader Willi or something traumatic that's happened. And it doesn't have to be right at that moment. It can be the next day. It can be even a few days later. But just coming back to your child and saying, "Hey, I know that on Tuesday that was pretty difficult, and I'm wondering if we could just talk about that for a little bit and let me know kind of how you're doing." The siblings felt like that they really appreciated that. Teaching the person with Prader Willi, if possible, that different people in the family had different diets and different food plans, and so it's okay for the sibling to be eating different food than the person with Prader Willi. A lot of siblings felt that that was really helpful, so that they didn't feel like they always had to be eating what the person with Prader Willi was eating, or eating secrecy if they were eating something else. So just some ways of considering the sibling when kind of developing meal plans. Interestingly, I did ask siblings if they thought that eating separately from the person with Prader Willi would be helpful, and almost none of them wanted that. They liked the idea of having that family meal, the family dinner time. I think a few of them said, "Our family is already different enough. It's important to kind of have things that are like other families, like family dinners." I think it's important to celebrate the siblings, um, their accomplishments, whatever, they're enjoying, to really like pay attention to those opportunities when you can really um, just celebrate them and help them to feel special too, for their own life, not just for being simply a person with special needs. Um, the other thing is that a number of the siblings in our study uh, were old enough to be thinking about career plans or what they're going to study in college. And many of them talked about wanting to go in fields they felt related to for another sibling of Prader Willi, such as special ed teaching, healthcare, being a nurse, doing research, and advocacy for people with disabilities. So, even though it's a difficult journey for me as siblings, there are some good things that I think can come out of it as well. I think, again, even though there are difficult moments, many of these siblings talked about feeling like they were um, more responsible, more compassionate people, and had really thoughtful career and job plans. And I'm not sure that would have been the same journey for them if they hadn't had that special experience. And I think that some of the best healthcare providers and researchers out there are the ones who have a heart in what they're doing. And usually that's because they had some personal experience.